The Scripps Howard Foundation, in cooperation with the Scripps College of Communication at Ohio University, is proud to honor excellence in investigative reporting with the Ursula and Gilbert Farfel Prize. The winners, Marshall Allen and Alex Richards of the Las Vegas Sun. Hometown humor is a way local residents can vent about the things they feel powerless to change. With the reputation Southern Nevada hospitals had for causing preventable injuries, infections, and surgical mishaps, a popular joke went like this: "Where do you go for great health care in Las Vegas?" "The airport." The not-so-good joke piqued reporter Marshall Allen's interest. Using hospital billing data on file with the state, Allen and his Las Vegas Sun colleague Alex Richards analyzed 2.9 million records going back a decade and identified 3,689 cases in which patients were harmed while healing, including 365 in which the patients died. Allen interviewed 250 doctors, nurses, hospital administrators, and patients who told their stories of harm suffered in Las Vegas hospitals.
She shouldn't have. I mean, they killed her. It was unnecessary.
Their 5-part series represented 2 years of reporting and included interactive graphics, video, documents, and a forum for readers to share how they've been affected by local hospital care.
I have a horrendous tale to tell you about hospitals.
Within weeks of publishing Part 1, 4 of the area's 13 acute care hospitals dropped their cloaks of secrecy and began publicly reporting these so-called sentinel events. The newspaper had stepped in where the government hadn't by imposing transparency on hospitals and giving voice to patients who had been powerless in defending themselves. So, what contained 30,000 words and received not a single request for the tiniest correction? The series Do No Harm, Hospital Care in Las Vegas. And that's no joke.
It's got all the elements that you would hope for in investigative journalism, ending in making a difference.
The paper really deserves a lot of credit, the Las Vegas Sun, for the commitment of time in a very small newsroom to doing this.
I think it's going to be a model for other large news organizations in other states to look at their states and their regions and compare how their hospitals are doing.
And now, presenting the Ursula and Gilbert Farfel Prize for investigative reporting and $15,000 to Marshall Allen and Alex Richards of the Las Vegas Sun is Roderick McDavis, president of Ohio University, home of the Scripps College of Communication.
I remember sitting at the kitchen table of Carol LaRocca, an elderly woman living on a meager fixed income and feeling uncomfortable as she wept. And she was crying not because of the hospital-acquired infection she had picked up while healing from a surgery, but she was crying, which had almost taken her life several years before. But she was crying because she was being hounded by bill collectors for the hospital bill that had been sent to her for the antibiotics that were used to treat the infection that she picked up in the hospital. And so this woman living on a fixed income still owed thousands of dollars for an infection that was not her fault. That's just a microcosm of the injustice that's faced by hundreds of thousands of patients every year in the United States who are infected or injured from things that are preventable in our hospitals. Many of them who die. They estimate hundreds of thousands of patients die from preventable harm in the hospital every year. And most of them do not get an apology, and many of them get a bill. So this is information that the hospitals know, the medical industry knows about, but they withhold from the public. And so I'm grateful for the support of the Sun that they gave Alex and I the time to find a way to identify where these injuries were taking place in Las Vegas hospitals. These are things that can be done in other communities around the country. And if we were to thank everyone who was involved in the project, we would have to have about 300 people up here on the stage, because those were the doctors and the nurses and the patients and the hospital administrators and the legislators and the regulators who helped really make these stories happen. And if we were going to, give recognition to everybody who's affected by this issue, we'd have to fill the stadium across the street about 5 times just for the number of people who are harmed in the hospital every year. So we're thankful for the foundation and this award because it brings such recognition to such a life and death issue. And the medical industry has been slow to acknowledge these problems, but I think with the publicity and with the public pressure, they're beginning to wake up. And so it's really they that need to make the internal changes to protect patients. And but we're very thankful for this award. Thank you.